So this is a hip evaluation radiograph, and I just kind of wanted to go over some of the things you want to look for. This dog was being evaluated for a OFA certification. Generally that happens at about 2 and above, 24 months and older. So a couple things you want to notice. One is you want them to be straight, so you want these obturator foramen to be exactly equal, so right side to the same. You want the spinous processes to be right on top of the vertebrae, so you can see that there. So that means the animal's very straight. The other thing that you want to look for is the hips. You want to see at least 2/3 coverage of the acetabulum into over the top of the femur, the head of the femur, and you want to see a nice neck. So you want to see this little divot right there on each side. That's good. As far as positioning, you also want the kneecaps to be right over top of the patellar groove. So the patella's right over the patellar groove, and you want the femurs as straight as possible. So this is the optimum way to evaluate a hip assessment. You're not always going to get these to be good. As you'll notice, like this was our first try, which you can somewhat evaluate how well the hips are, but you can definitely see that the kneecaps, the patellas are not right on top of the patellar groove. The femurs are not exactly parallel and straight. So that just makes it a little bit harder to evaluate, but that's probably what you'll get on more of a non-sedated dog. Whereas this one, this one was sedated. So just kind of things to look for when you're doing your hip radiographs.